Hi all, welcome to another video. In this video, I'm going to explain in detail about microwave diathermy. So coming to the contents. So by the end of this video, you will be able to understand about the definition, wavelength and frequency, production of microwave applicators, dosage parameters, physiological effects, therapeutic effects, indications and contraindications, dangers of microwave diathermy. Coming to the introduction, microwave diathermy can be defined as the use of microwaves for various therapeutic purposes. The microwaves are a form of electromagnetic radiation. So they lie between the short wave and the infrared waves in the electromagnetic spectrum. The microwave diathermy can directly penetrate into the tissues to some extent and can be strongly absorbed by the water and highly vascular tissues. So this is the diagrammatic representation. So you can see here microwaves and this is the infrared. So radio waves. So it lies in between the short waves and your infrared waves. So microwaves lies between your infrared waves and your short waves of your radio waves. So this is the electromagnetic spectrum diagram. So this is the same similar diagram but a different format. So you can see here short wave. Short wave is one type of radio waves, and this is the microwaves, and this is the infrared waves. So microwaves lies between your infrared waves and the short waves of the radio waves of your entire electromagnetic spectrum. So microwave, like another electromagnetic radiation, travels at the speed of light and are governed by the laws of reflection, refraction, absorption, and inverse square law. So the microwave diathermy works on the principle of thermionic emission. So the microwave diathermy principle is based on the thermionic emission. So coming to the wavelength and frequency, the microwave diathermy has a much higher frequency and a shorter wavelength comparing with your short wave diathermy. So microwave diathermy has a higher frequency and a shorter wavelength than your short wave diathermy. The frequency ranges from 300 megahertz to 300 gigahertz. So the frequency ranges from 300 megahertz to 300 gigahertz. The wavelength ranges from 1 centimeter to 1 meter. The commonly used frequencies are 2456 megahertz and 12.2 centimeter wavelength, and 915 megahertz frequency and 32.8 centimeter wavelength, and 434 megahertz frequency and 69.1 centimeter wavelength. So the frequency, so coming to the, if the frequency decreases means the wavelength will be increasing. So this is the relationship between your frequency and wavelength. Frequency increasing means the wavelength will be decreasing. Coming to the production of microwave radiation, the microwave diathermy apparatus is connected to the main AC, which provides it a current of 50 Hz frequency and a voltage of 220 volts. It is not possible to produce microwaves by a mechanical means, and hence a special type of thermionic valve is used, which is called magnetron. So microwave waves cannot be produced by a mechanical means. So microwaves are produced by a special type of thermionic valves that is known as magnetron. So microwaves are produced by a special thermionic valve which is known as magnetron. The primary function of magnetron is to produce high frequency current required for the production of microwaves. The main function of the magnetron is just to produce the high frequency current required for the production of microwaves. So the magnetron, which is a diode valve, produces a high frequency alternating current carried by a coaxial cable to the transducer or director. The magnetron is a special type of thermionic valve characterized by a centrally placed cathode and a surrounding circular metal anode. So the emitter consists of antenna and a reflector. Coaxial cable carries this high frequency current from the magnetron and passes it to the antenna of the emitter. So in this diagram you can see here, this is the mains and this is the power supply from the mains, and we have a fan and cathode heater control circuit. So this is the intensity control and this is the magnetron. So the magnetron is responsible for producing a high frequency current in order to produce the microwaves. So this is the magnetron, this is the coaxial cable, and this is the emitter and reflector and antenna. So this is the simple circuit diagram for your production of microwave diathermy. Emitter is known as director or applicator. The high frequency current passes through the antenna. This results in transformation of electrical energy into electromagnetic energy. So the electrical energy will be converted into electromagnetic energy. So this energy is then focused by reflector and beamed into the tissues. The intensity can be varied by changing the amount of power supplied to the magnetron. So antenna is mounted in front of a metal reflectors. Reflector is a metal plate which directs the microwaves in only one direction. So reflector, it is a metal plate which will be responsible for directing the microwaves in only a single direction or in a one directions. Emitters are of various shapes and sizes. So each shape has a particular effect. So there are two main shapes, that is your circular emitter and your rectangular emitter. So basically emitters are either circular in shape or rectangular in shape. The circular emitter produces microwaves which are circular in cross section and denser in periphery than in the center. So circular emitter will be having a circular cross section and they will be having a denser or deeper effect in the peripheral region than in the center region of the emitters. Rectangular emitter produces waves which are oval at the cross section and denser at the center than at the periphery. Circular emitter will be having denser in the periphery, but rectangular emitter will be having a denser at the center. So this is the difference between the circular emitter and the rectangular emitter. The distance between the emitter and the skin should be at least 10 to 20 centimeter from the body. So we should not directly apply on the skin. So it should be kept at a distance between 10 to 20 centimeter from the treatment area or the body area or region which you are going to treat. However, this can vary according to the size of the emitter, the part to be treated and the condition of the patient. If the small area is to be treated, emitter should be closer to the skin, that is around 2 to 5 centimeter. And if the area is to be treated is larger, the distance can be increased to around 10 to 15 centimeter. So the placement of electrode will be dependent upon the size of the treatment area. If the treatment area is smaller, means we need to keep the emitter nearer or closer to the affected or treating area. So that is the skin, around 2 to 5 centimeter nearer to the area. And if the treatment area is larger, means we need to keep at a increased distance, that is around 10 to 15 centimeter from the affected area or the treatment part. And this is the control panel of your microwave diathermy unit. So this is the A, that is your power switch. B is your timer to set the timer, set the different time or duration of treatment. And C is your output meter. And D is your power output level. And E is your indicator lamps. So this is the basic control panel of a microwave diathermy unit. So, and these are the different applicators of your microwave diathermy, circular emitter as well as rectangular emitter. And there are different brands. So most of the machines are costly. And coming to the physiological and therapeutic effects, the physiological and therapeutic effects of microwave diathermy are same as that of shortwave diathermy. Microwave diathermy is useful more in local conditions than in the generalized conditions. The amount of heat production is more in muscles as compared to shortwave diathermy, since the heat production by the microwave diathermy depends on the watery content of the tissues, because the microwave diathermy has an effect that is mainly absorbing in the watery content of the tissues, have a more absorbing effect near the watery content. So microwave diathermy is more useful in the treatment of superficial tissues, those with high fluid content. The depth of penetration of microwave diathermy in the tissue is less and ranges between 3 mm and 3 centimeter, while the shortwave can penetrate as deep as 6 centimeter. So comparing the penetrating capacity or penetrating depth of the microwave diathermy with shortwave diathermy, microwave diathermy have a less penetrating power comparing with the shortwave diathermy, because microwave diathermy can penetrate only up to 3 centimeter, but the shortwave diathermy can penetrate as deep as 6 centimeter. So shortwave having a higher penetrating capacity comparing with the microwave diathermy. It can be used in traumatic and inflammatory conditions, degenerative arthropathies, endosopathies, arthritis of the arthritis, etc. It is useful in the treatment of soft tissues and superficial joints because it is generally possible to irradiate only one aspect of body at a time. So mainly microwave diathermy is useful for treating the superficial areas comparing with the shortwave, because shortwave has a higher penetrating power comparing with the microwave diathermy. And coming to the physiological effect, the basic events which take place when microwave diathermy is applied to the tissues are your penetration, absorption, reflection, heat, conductions. So first one is your penetration. The depth of penetration depends on the frequency of the wave and the properties of the medium which it is penetrating. In general, the wave energy decreases exponentially with distance traveled and decreases as the wave frequency increases. Tissue of low water content are penetrated to a greater depth than tissues of high water content. The effective penetration of 2450 megahertz microwave is said to be approximately 30 millimeter, that is 3 centimeter. The maximum penetration depth of microwave diathermy is 3 centimeter, whereas the penetration capacity or penetration depth of your shortwave diathermy is 6 centimeter. So the absorption, second one is your absorption. The electromagnetic energy is transformed into heat energy as it interacts with the molecules of different tissues. The non-polar molecules will distort towards the alternating change in the field. The dipolar molecules will rotate back and forth. The ions will vibrate in the field directions. The resultant energy losses are converted into heat energy, and the differing electrical properties of different tissues determine the amount of absorption which will occur. For example, muscles and other tissues of high fluid content will absorb more electromagnetic energy than tissues such as fat or bone. So comparing with the, since I already told regarding the absorption capacity of the microwave, so those with a higher fluid content will be having more absorption. Microwave will absorb more comparing with the those area or those region or those tissues which is having lesser fluid content. So microwaves will be having higher absorption effect at the region where there is high fluid content. So muscles and other tissues of the high fluid content will absorb more electromagnetic energy than tissues such as fat or bone which is having less fluid content. Third physiological effect is your reflection. The proportion of waves reaching the deeper tissues is also dependent upon the amount of energy which is reflected at the air skin to fat, and fat to muscle interfaces back into the air, the skin, and the subcutaneous fatty layer respectively. The relative amount of energy reflected is determined by the electrical properties of the tissues. At frequencies below 1800 megahertz, most of the energy reaches the deeper tissues, while for frequencies of 2450 megahertz, the distribution of the energy depends critically on the thickness of the skin and the subcutaneous fat. As much as 50% of the energy may be reflected at the air-skin interfaces. Next physiological effect is your heat conduction. Once the microwave energy has been converted into heat energy, heat exchange will occur with other areas of lower temperature until a steady state is achieved. So coming to the therapeutic effects, the therapeutic effects of microwave diathermy are similar to those of shortwave diathermy, but since the penetration of microwave is only superficial, it is only likely to be effective in the treatment of superficial structures. Since I already told you, the penetrating capacity of microwave compared with the shortwave diathermy is almost half, that is 3 centimeters. So it can be only the penetration can only reach to the superficial tissues. So it can be only effective for the treatment of superficial structures. So it is more suitable for the treatment of localized rather than widespread conditions. The therapeutic effects includes pain relief, reduces muscle spasm, resolution of chronic inflammation, delayed healing, infection, fibrosis. First one is your pain relief. The relief of pain by microwave diathermy is useful in the treatment of traumatic and rheumatic conditions affecting the superficial muscles, ligaments, and small superficial joints. And second therapeutic effect is to reduce the muscle spasm. So maybe reduced directly by microwave diathermy, or maybe reduced by the pain which is contributing to it. So it is like pain spasm cycle. If the pain is getting reduced with the help of this microwave diathermy, means automatically the muscle spasm will also get reduced. That is the pain spasm cycle. So it breaks the pain. Microwave diathermy is responsible for breaking the pain spasm cycle, thereby reducing the pain as well as muscle spasm. Next is resolution of chronic inflammation. Resolution of chronic inflammation may be accelerated by treatment with microwave diathermy as a result of increase in the blood supply and aids the resorption of edema exudate. So since because of the heat, superficial heat, the blood flow will be getting increased. Vasodilatation causes the flushing out of your exudates, edema exudates towards your lymphatic nodes. So it will be helpful for flushing the lymphatic fluids, excessive waste towards your lymphatic nodes. Next therapeutic effect, that is a fourth therapeutic effect, is your delayed healing. To promote the healing of open skin areas, an increase in the cutaneous circulation may be of assistance, providing the vascular responses to heat are normal. So because of the increased blood supply, that is your vasodilatation, the region which is getting delay in healing means healing, that region will be healing better because of the increased blood circulation, that is vasodilatation, as a result of application of microwave diathermy. It promotes the healing processes. If the arterial or capillary dilatation does not allow sufficient increase in blood flow, sheet should not be applied directly, but may be applied proximally to an area with good blood supply. And next therapeutic effect is your infection. Treatment with microwave diathermy may assist in the control of chronic infection by increasing the circulation, by an increase in the number of white blood cells and antibodies brought to the area. Because of the increased blood flow, that is so the WBC will be getting increased, so that may help to fight the infections. So it produces antigen antibody reactions, so that may be helpful for reducing the infection. So next therapeutic effect is your fibrosis. Heat has been found to increase the extensibility of fibrous tissues such as tendon, joint capsules and scars. The effect is produced by temperature increases with the therapeutic within the therapeutic range. So fibrosis. So because of the increased heat, the extensibility of these tissues will be getting increased, so thereby reducing the effect of fibrosis. So coming to the technique of application of microwave diathermy, the first one is your preparation of apparatus. The selected emitter is now connected to the machine by appropriate cable and the power is switched on. The emitter may be either your circular emitter or a rectangular emitter. So it depends upon what kind of effect you need. So there will be some delay before output is obtained, but then the physiotherapy tests the apparatus by placing her hand or arm in front of the emitter and increasing the output until a sensation of warmth is experienced. So after application or after fitting of the particular emitter, that is your circular or rectangular emitter, the power will be switched on and the therapist will be self-testing the apparatus. That is the preparation of apparatus. So self-testing with the help of the therapist's arm or hands placing under the emitter. So and the output is increased. The output switch will be increased. So thereby the heat will be produced. So once the sensation of warmth is experienced by the therapist's hand, means the machine is prepared for the treatment. The controls are then turned to 0 and switch turned to stand-up position. So after checking the apparatus is working or not, the output switches are turned back to 0 and kept in the normal position and kept ready for the treatment of the patient. The second step is preparation of the patient. This is same as the preparation for the application of shortwave diathermy. The patient must be warned to avoid excessive movement once the emitter has been arranged in position, and the patient should be in full support in a comfortable position to ensure the proper delivery of the microwave diathermy. The patient is fitted with a pair of wire mesh goggles to protect his eyes. So in order to prevent the danger of getting irritation in the eyes or getting irradiation towards the eyes, they will be given a pair of wire mesh goggles to protect their eyes. Next step is selection of treatment applicator. Various types of emitters are available. Those most commonly used are placed at a distance from the body, and the waves pass through the intervening air to reach the tissues. Emitters of this type may be circular or rectangular in shape. So next step is we will be selecting the emitter. So that will be either in circular or rectangular in shape based on the effect which we needed. The circular one gives a beam of rays which is circular in cross section and is more dense at the periphery than in the center. The rectangular emitter provides a beam which is oval in cross section and is of higher or greater in density at the central. So the circular will be having a circular cross section and they will be having a higher density at the periphery. And the rectangular emitter will be oval in cross section and they will be having a greater density at the central. Next step is selection of appropriate power level and the application of treatment. The first step is selection of appropriate power level. The patient is reminded of the sensation to be expected and of the need to report accurately on that experience. The output is increased until a sensation of warmth is experienced or the selected output is reached, whichever comes first. So first, before increasing the output, we will be explaining in detail about the effect. So that is to be expected. So the sensation, they will be feeling a, we will be explaining the patient that you will be feeling a sensation of warmth. So if the sensation of warmth is non-tolerable, means you just report like that. We'll be explaining, as a therapist, we'll be explaining to the patient. So once the warmth, sensation of warmth is achieved or experienced by the patient, the output, until that, the output will, we will be increasing the output. Irradiation continues for an appropriate time. The physiotherapist should visit the patient frequently to ensure that nothing untoward has occurred. The output is then reduced and switched off. Slight erythema may be observed, but there should be any marked skin reaction. So erythema is the normal changes that occurs as a result of increased blood flow because of the effect of this heat. Vasodilatation occurs, so erythema, slight erythema may be observed. Apart from that, if there is increased skin redness, means that is one of the danger. So in order to prevent that, we will be asking the patient regarding the effect of heat. If the heat is non-tolerable, means we will be reducing the output. So next is application of treatment. The emitter is arranged so that its surface is parallel to the skin and appropriate distance, due consideration being given to the surface marking of the structure to be treated. Irregular surface and areas which perspire freely should be avoided. So emitter will be arranged in a parallel manner or parallel way towards the treatment area and at an appropriate distance. So for small duration, small regions, means it will be placed at 2 to 5 centimeter. And if the treatment area is larger, means we will be keeping at a distance of 5 to 10 to 15 centimeters. So this is how we will be giving the, or we will be keeping the applicator or emitter. And we need to avoid the irregular surfaces or areas which are perspiring or sweating frequently. And coming to the dosage parameters, the dosage can be calculated from the power output from the machine, which may be up to 200 watts, so as to raise the body temperature in the therapeutic range of 40 to 45 degrees Celsius. But in all cases, the sensation experienced by the patient must be the primary guide. The dosage depends upon different persons, because it may change or it may vary from person to person because of the thickness of the skin or viscosity of the skin or the capacity of the patient. So it depends upon the tolerance level of the patient. So it depends on many parameters. So the primary guide should be the sensation experienced by the patient. Dosage will be dependent on the sensation experienced by the patient or the tolerance level of the patient. The patient should feel comfortable warm as observed while blowing from mouth on the dorsum of the hand. This should be never be more than a comfortable warmth, and as a general rule, weaker doses should be used for acute than for chronic conditions. The duration, the irradiation ranges from 10 to 30 minutes, shorter exposure being used on smaller areas and for acute conditions. So in acute conditions, 5 to 10 minutes, and in chronic conditions, 15 to 30 minutes, depending upon the condition of the patient and the type of applicator used. The treatment may be given daily or on alternative days. So acute conditions means we should be using lesser duration or lower duration, that is 5 to 10 minutes. And in chronic conditions, we can use higher duration or a longer duration, that is 15 to 30 minutes. This all depends upon the condition of the patient and the type of applicator you are using, whether it's a circular emitter or a rectangular emitter. The treatment can be given daily or on alternative days. And coming to the indications, microwave diathermy is indicated for the treatment of superficial stretches. As I already discussed in the previous slides, it has only a penetrating capacity up to 3 centimeters. So microwave diathermy is indicated for treatment of superficial conditions only. However, low frequency microwaves allows deeper heating if there is only a thin subcutaneous fat layer. If the patient's or a client's fat layer is subcutaneous or having a thinner layer, means it can go much deeper comparing to your normal penetrating capacity, which is till your superficial region. But however, low frequency microwaves can have a deeper heating if there is only a thin fat layer. So it is used in the treatment of musculoskeletal disorders, sprains, strains, capsular lesions, muscle and tendon tears, synovitis, bursitis, tenosynovitis, hematoma, joint stiffness, that is over your superficial joints, degenerative joint diseases, your OA, RA like that, chronic rheumatoid arthritis, superficial inflammatory or infective conditions, infected surgical incisions, carbuncles, and abscesses. So in essence, we can say that all the superficial conditions can be treated with this microwave as well as small deeper conditions like suppose if the patient or client's fat tissue is having a thin layer means it can go much more deeper comparing with your normal superficial effect. Coming to the contraindications, microwave diathermy should not be used over your malignant tissues, over ischemic tissues, moderate and excessive edema, over wet dressings and adhesive tape, metallic implants. Pacemakers, over the growing bone, over the male gonads, hemorrhagic areas, tuberculous joints, those who are having impaired thermal sensations, and those who are having a unreliable patients or unconscious patients. And recent radiotherapy, hypersensitivity to heat, acute infection or inflammation, those who are obese, analgesic therapy, venous thrombosis or phlebitis. Phlebitis means inflammation of your vein. So these are the contraindications, and the dangers includes burns because of the excessive heating. If the patient does not tell the like they didn't tell means they may have a chance of getting burns because of the excessive heat produced by the microwaves. Or suppose it's a contraindicated for example a contraindicated patient, those who are unreliable patient, suppose you accidentally given this microwave means they may also have a chance of getting burns, or unconscious patient, or even those who are having decreased sensation means they can also have a chance of getting these burns. Next is your earth shock and electric shocks, touching the apparatus, moving. So this may all lead to cause of this earth shock or electric shock, and danger to the eyes. So this can be prevented by giving them a protective wire mesh goggles towards this danger. That is your danger to the eyes. Coming to the precautions, those with menstruation, those are pregnant, and do not increase the intensity unless the coaxial cable is correctly connected both to the machine and to the director. Ensure that the machine is correctly earthed. So this all can be used as a precautionary measure in order to prevent the dangers. Do not touch or allow the patient to touch the machine if you are earthed, for example by also touching another machine which is switched on, or touching a water pipe. So this can if you are not having a precautionary measure means this can lead to a earth shock. Do not position the director in such a way that eye should receive the radiation. Mesh goggles are available to protect the eyes. Avoid irritating the male gonads. Do not position the director over any metallic surfaces, otherwise reflection may result in damage to the magnetron. If the patient is wearing a hearing aid, it should be switched off as the high frequency of the microwave produces marked interference. And coming to the guidelines for the safe use of diathermy, so we need to follow these guidelines. First step is question the patient regarding the contraindications and previous treatment, whether you undergone this previous microwave diathermy treatment and all. Next, we need to position the patient, which should be in a comfort and modesty manner. Second, inspect the part to be treated. Check for the rashes or infections or open wounds. And if indicated, drape the area with toweling and place the electrode drum on the treatment area. And we need to turn the switch on, and we need to set the pulse duration, pulse frequency, and we need to adjust the intensity. And we need to set the treatment time, usually 15 to 30 minutes for chronic cases, or for acute cases means 5 to 10 minutes. We need to press the start button. Periodically ask the patient if heating is too vigorous. If the patient is saying that the heat is not tolerable means we need to decrease the power output. And when timer shuts off, terminating the patient, turn all dials to 0. We need to ensure that all the dials are turned to 0 before removing the apparatus. And we need to assess the treatment efficiency. We need to inspect the area, and we need to get feedback from the patient. So we need to inspect the area. Mild erythema will be seen because of the increased blood supply. And if the inspected area is too ruddy means we need to do further things, and we need to ask the feedback from the patient, whether how you are feeling now, whether the treatment is getting improvement, like that. So this is the feedback we need to get from the patient, and we need to tell the next section when we are planning for the next section. So all this we need to tell, and we need to record the treatment parameters. Recording the treatment parameters, documentation, this is one of the important thing you need to follow even in your clinical practice, because we need to be in the safer side. So always we need to record the treatment parameters, as well as all the things we need to record and document regarding the patient which you are encountering in your clinic or in a hospital setup. So documentation is one of the important things that you will be studying mainly in your PG. How documentation will be important in order to protect yourself. So these are the guidelines for the safe use of microwave diathermy. By this, and concluding this video about microwave diathermy, please do share and subscribe this video to your physio friends and community. Stay tuned and thank you for watching this video. Thank you.